So you should have seen a notification that, or it should pop up in a second. It's just loading.
Yeah, we got it.
Perfect.
I did at least.
So yeah, welcome everyone, and thank you very much for joining us for today's Open Digital Health research conversation or discussion. It's really good to see some people joining, even with this lovely summer weather. We were already saying most of us were working from home or trying to find a shady area where it's cool enough to keep the head cool. So yeah, it's good to see everyone. It is my, so I'm Sebastian Potthoff. I'm a lecturer at Northumbria University in the UK, and I'm one of the directors of Open Digital Health. And today it's my pleasure to introduce Dr. Kevin Doherty. Kevin is a human-computer interaction researcher with a background in engineering, computer science, and design. His work exemplifies and advocates for a human-centered approach to digital technology, targeting the areas of greatest human need, including growing rates of chronic and comorbid physical and mental illness nationally and globally. Currently, he holds a dual role as a postdoctoral researcher at the Copenhagen Center for Health Technology at the Technical University of Denmark, and an associate public health researcher at Copenhagen University, where his research focuses on the design of mobile technologies to support the practice of mental health care through primary care. In today's talk, Kevin will recount and reflect upon the challenges, failures, successes, and joys of a decade of collaboration across cultures and disciplines in the design, development, and deployment of digital health interventions spanning England, Ireland, and Denmark. So I'm very much looking forward to this, and I will hand it over to Kevin.
Very good. Thanks for the kind introduction, Sebastian. As I was saying just before the talk, apologies if I'm a little dark on the screen. I just moved to a new office and haven't quite figured out the ideal Zoom lighting just yet. So yeah, I'm very much looking forward to the conversation today. And I thought we'd kick off with a short presentation, which I have titled Interdisciplinary Digital Health Technology Development, a Decade of Lessons Learned from England, Ireland, and Denmark. So as you can tell, I haven't been half ambitious in preparing this talk. But what I'd really like to focus on is the first term of the title, interdisciplinary. And I'd like to talk about what we might mean by this term, how it might shape the kinds of work we do as digital health technology researchers and developers, and how it also might shape perhaps how we see ourselves in relation to this work. So Sebastian gave a very kind introduction to myself there. Not to reiterate everything you said, but maybe just to emphasize why this topic of interdisciplinarity is so close to my own heart. I very much have an interdisciplinary background in terms of the subjects I studied, from engineering to design and now human-computer interaction, but also in terms of my research interests, which cut across mental health and technology development, and in terms of some of the collaborations I've been part of, which have involved collaborators not only in academia, but also industry. And so I thought I'd start this talk by returning to a story which I think is kind of very relevant to all of us here today, and that is in many ways the Open Digital Health story. And so Open Digital Health as a community are really focused on this challenge of evidence-based tools that die too early. So I think this is a story which many of us here today will be quite familiar with. We might dedicate kind of years of time and effort to developing new technologies, developing studies, deploying them with users, gathering data, publishing that data. And then once the funding runs out, those technologies tend to fade into obscurity. So that's something we'd like to change. And one way in which the Open Digital Health community proposes to do this is to provide an opportunity to share these tools, the code and results and data, among others across nations and disciplines as ways of ensuring their sustainability moving forward into the future. And so an important part of this story also then is interdisciplinarity. And it's not only in this context that interdisciplinarity is increasingly seen as essential. So a variety of different researchers and academics have talked about the importance of truly interdisciplinary efforts as a way of addressing complex challenges, the kind of increasingly complex challenges we're trying to address through applications of technology. Others have written about the importance of broad-based interdisciplinary support to giving us a better chance at success when it comes to realizing change in the real world. And finally, we might think about interdisciplinary research and related educational practices as leading us to meet at the interfaces and frontiers of our own and other disciplines. And this, of course, brings with it new opportunities and also challenges. That said, interdisciplinarity certainly comes with challenges for those of us working within our own fields or across fields. And for those of us who consider ourselves human-computer interaction researchers, that's a term I might use quite often during this talk. I might shorten it to HCI at times. So if you hear me say HCI, I mean human-computer interaction. Many of us are working in a very interdisciplinary space, which has led other academics to accuse us as either having no homes or perhaps many homes. And as I say, this comes with many factors and challenges worth thinking about. But of course, it's also important, I think, that we have a sense of what it means to be interdisciplinary. And so this must, in some sense, go beyond abstract notions of collaboration towards kind of a more precise and defined approach to research, as expressed by Singh et al. Here. And finally, in terms of the challenges related to interdisciplinarity, Blackwell argues that the agenda of design is a challenge to academics in all disciplines. And I think this is importantly relevant to those of us who are trying to not only research, but build new technologies, which creates many challenges for the kinds of research we want to do. That's not to say, of course, that we don't have any kind of understanding or definition of interdisciplinarity. There are many out there. And I thought I would include here just one quite well-cited definition of interdisciplinary research developed through systematic review. And so Abdullah et al. Describe interdisciplinary research as any study or group of studies undertaken by scholars from two or more distinct scientific disciplines. Research which is based on a conceptual model that links or integrates different theoretical frameworks from those disciplines, uses study design and methodology not limited to any one field, and requires the use of perspectives and skills of the involved disciplines throughout multiple phases of the research process. And so there's many different things to think about here. Beyond interdisciplinarity, however, some here today might have heard of a variety of related terms like multidisciplinarity, cross-disciplinarity, transdisciplinarity. And so it's very easy to become kind of lost in the literature in this space. One means I like of cutting across this kind of broad swathe of literature is also proposed by Abdullah et al., who talk about these different typologies of interdisciplinary research as comprising different degrees of synthesis across fields. And so we might think of multidisciplinarity, for example, as involving academics working almost in parallel from their own disciplinary bases versus more transdisciplinary ways of working where researchers from different fields work very closely using similar conceptual frameworks. Then again, we might take a step back and ask the question, what exactly do we think are the many and varied disciplines of digital health? So I think this is one of the really unique features of the digital health context, is the fact that just so many disciplines are involved in the kinds of challenges and problems we're trying to solve. And so this stems not only across researchers in the STEM space, science, technology, engineering, and mathematics, but also increasingly involves researchers from the humanities, arts, and social sciences. And so I think there are some important distinctions here, not only in terms of the labels we might apply to ourselves or the fields we're working across, but also in terms of how we think about problem solving, whether trying to develop new technologies which strive for simplification, for example, or trying to embrace the complexity of the problem spaces in which we work. And so I've talked a little about this kind of conceptual map of disciplinarity and interdisciplinarity. But of course, many of us here are working very much to develop and deploy technologies in the real world. And so I think it's worth asking what we think working in an interdisciplinary way takes in practice. And if the literature is clear about one thing in this space, it's that doing so is quite a serious challenge. So Williams et al., for example, write that despite much research as to why human-computer interaction, for example, should work in an increasingly interdisciplinary way, there's limited work focused on just about how we can do this. Abdullah et al. Also make a very important point, I think, which is that the mere addition of researchers from different disciplines and fields is not necessarily sufficient to make a research effort interdisciplinary in nature. And I think that's a really important point for us to think about. Finally, there has been a push in the last few years for us to become more interdisciplinary in the ways of working. And that, of course, brings some advantages in terms of what we can achieve. But it's also worth asking the question, as Bremer et al. Highlight here, at what point do we lose track of our own core disciplines or struggle to know, for example, exactly what we should teach at the institutions we're employed at? So I think these are some quite difficult and ambitious questions. And what I wanted to do in this talk is to begin to interrogate for myself and my own work how exactly I come about this question of interdisciplinarity. And I thought I might best do so by working through kind of 3 examples of interdisciplinary collaborations I've been involved in over the past 10 years or so. The first in the context of Irish rehabilitation care, the second in the context of perinatal mental health care in England, and finally focused on Danish general practice. Interdisciplinarity is a very long word to say, many times. So let's start by looking at the first of these topics, which I thought would kind of might lead to some interesting discussions today. And that's a project I was involved in about 10 years ago or so in the National Rehabilitation Hospital in Dublin. And so in this clinic, speech and language therapists in particular work with patients who have experienced acquired brain injury, for example, and frequently augment the kind of cognitive therapies that they do with those patients through commercial software deployed on tablet devices. And so I spent some time at the hospital on a related project. And during my time there, while speaking to some of the clinicians there, I began to realize that the patients and the professionals were facing some challenges in their work that were really related quite directly to poor interface design, the poor usability of some of the applications they were using, and also the inflexibility of these mobile applications when it came to working with diverse patient groups. And so this was something I thought that I could have a go at improving. And so I did so. So over a period of 6 months or so, I worked with clinicians at the hospital to develop a series of 4 mobile apps. And really the focus in developing these apps was to see whether we could develop this kind of maximally adaptable and flexible form of interface design, which would enable the clinicians to tailor access for patients to different kinds of digital media. So these consisted, for example, of essentially a redesigned YouTube interface, a personal photo and music center, and a tile-based communication app, which was actually used in therapy sessions between patients and health professionals. And so the purpose of these applications on the whole was to facilitate communication, enable remembering experiences for patients, as well as simply to access or improve access to entertainment for patients at the clinic. And so I'm only going to give a very brief overview of some of these projects here, but what I really want to focus on is the nature of the interdisciplinary work at the heart of each of these projects. And I give this first example as an instance of an interdisciplinary collaboration, which essentially involved 2 individuals, myself in the form at the time as a software developer and an interaction designer, also as a master's student, in interaction with a quite senior speech and language therapist at the hospital. And so, as I say, this was certainly an interdisciplinary collaboration, but of what kind? And so in thinking back on the kind of interdisciplinarity involved in this project, I've come to think of this as a kind of practice-oriented approach. This project took place over the period of 6 months. It had quite a well-defined outcome from the start. We knew that we wanted to develop and improve these kind of mobile applications for this patient group. But it was also quite a spontaneous meeting, which involved a focus on the professional skills and experience which could each bring to this interaction, and had very little formal research component involved. And so throughout this project, we were really speaking from professional experience rather than from specific academic disciplinary perspectives. And so I think there's some important questions we could ask about this kind of interdisciplinarity. For example, is this a sustainable model of practice? Many of us here today are probably and most likely involved in quite ambitious collaborations designed to, for example, prove the efficacy or feasibility of a technology over a long period of time. But this is an example of a project in which we were able to have some impact in the real world practice of care, despite not reaching the scale or ambition of other kinds of interdisciplinarity we might think about. And so I'll just leave us with that question here. The second project I want to talk about took place in the context of perinatal mental health care in the UK. And so this was the focus of my PhD work. And as I say, took place in the English context as part of a collaboration between computer scientists at Trinity College Dublin and public health researchers at Imperial College London. And so it's estimated that as many as 15% of women are diagnosed with depression each year during pregnancy. And this means that perinatal well-being is a public health priority across many different national contexts with significant and long-lasting intergenerational effects. And so to make treatment and support available to those women in need, it's widely thought that effective programs of assessment and avenues of disclosure are necessary. In the context of the UK's NHS service, mental health screening during pregnancy is typically carried out verbally or using paper-based questionnaires, completing it in waiting rooms. However, it's estimated that as many as 50% of women experiencing depression during pregnancy go undiagnosed. And recent surveys, for example, show that although almost all midwives report asking women about their mental health during pregnancy, as few as 1 in 10 women actually recall being asked by their midwives. And so this is an area in which we thought mobile technology, again, might be able to play a role in improving access to care. And so we developed a mobile application titled Bright Self, which we deployed through the NHS across 14 NHS midwifery clinics, and which was used by 355 pregnant women over a period of 9 months. And so those women provided during that time 2,280 reports of their well-being in daily life. And what we were most interested in, of course, was whether this technology could support access to care for those women who are most in need. And we found that 39 women during this time period reported a risk of depression or self-harm using the app and received immediate midwife support. Important to note here is that 2/3 of those women were not identified as at risk of depression at baseline screening. And so this is an area in which technology might have a role in supporting access to care in practice. In contrast to the previous project I talked about, this was very much a systematic and rigorous research process, which involved literature review, theory development, design research, study protocol and technology design, clinical deployment, data analysis, and reflection on our results. And so this also then was a project which involved many different collaborators across different disciplines. So involved in this project, for example, were computer scientists located in academia, but also in industry, public health researchers at Imperial College London, not only professors, but also postdocs, so people at different academic career stages, health professionals, including GPs and psychiatrists, and then, of course, the midwives and pregnant women who participated in the study and helped us to run it along the way. At the heart of this project, however, were 2 PhD students, myself, positioning myself in this case as a design researcher and computer scientist, working closely with another PhD student at Imperial College London, who was a public health researcher and medical doctor. And so again, I just wanted to take a few minutes and think back over this period in time and focus on what kind of interdisciplinarity was entailed in this work. And really what jumped out at me in thinking through this was that this was very much a research-oriented approach to interdisciplinarity. And so this was a 5-year project, which followed quite a formal and rigorous research and technology development agenda. And it was really our research objectives which were at the heart of this process. So we adopted a mixed methods approach, which was oriented around certain well-defined outcomes of interest, including outcomes related to engagement, self-report, and well-being. And although this was a large team involving individuals from different disciplines, in thinking back on this work, I think we quite clearly were able to maintain the definition of our disciplinary boundaries. So each discipline, whether that be us as computer scientists or our colleagues in public health, we were able to kind of engage in appropriately autonomous ways within the scope of our own disciplines. So, for example, as a design researcher in this instance, I was able to engage in the kind of creative design of the technology while giving our colleagues in public health the leeway to engage their expertise in organizing clinical recruitment, for example. And so although this was a very complex problem space in terms of grappling with the challenges of stigma related to mental health, different work practices across health professionals, our desire as researchers to gather data, I think the fact that we had quite a well-defined objective in regards to the deployment of the technology really helped us to kind of keep the project on track. And the last thought I had in thinking about this project, which I think we might reasonably deem a success, was that although there were many different disciplines involved, we had quite a highly motivated core of individual researchers, specifically 2 PhD students, who in that regard had a very much a shared goal and quite complementary skills. So the last example I want to turn to focuses on the Danish context and the context of my current work here, which relates to the practice of mental health care in general practice. And so in this project, we're very much focused on the topic of severe mental illness, which you might hear me define as or describe as SMI. And so this is a medical categorization of illness, which spans illnesses including bipolar disorder, major depression, and schizophrenia, for example. And these are conditions which have quite a significant impact on individuals' quality of life, as well as their life expectancy. So prior research shows that individuals diagnosed with SMI, on average, can live as much as 10 to 15 years less than general population. One of the really interesting findings from the prior research, however, is that this difference in mortality is not directly associated with their mental illness, but related to underdiagnosis and undertreatment of comorbid physical conditions. And so again, this is an area in which we thought an interdisciplinary collaboration might be able to make a difference. In Denmark, there has been a long-standing focus on person-centered care in general practice. However, despite this, GPs speak often of struggling to reach and engage with this particular patient group, and patients themselves diagnosed with these conditions that speak often of feeling unseen and unheard by the health professionals. So there's very much not only a medical, but an interpersonal challenge in this space. And so the overarching aim of this project, titled the Sophia Project, was to improve care for patients with SMI through primary care clinics across Denmark. And as part of this work, we have been working to develop new digital technologies to enhance individuals' quality of life, extend life expectancy, and improve the effective functioning of health services. At the heart of our approach, however, is really a focus on the idea that care is most effective when patients and health professionals alike feel seen, heard, and respected. And so I place this as the third example of an interdisciplinary collaboration, given the complexity of this the constellation of different disciplines involved here. And so this is not only collaboration between computer scientists and public health researchers, for example, but involves also a wide range of different anthropologists, psychiatrists and epidemiologists, GPs, not only as researchers, but participants, also statisticians, patients, of course, computer scientists, and then myself, who I position here as an HCI researcher. And so I think this is an interesting case to contrast with some of the previous examples of interdisciplinary work. And in thinking about this project, I've come to think about this as a kind of paradigm-oriented interdisciplinarity, and I'll try to give some sense of what I mean by that. So this is a 7-year project, and this means that the team members involved across different disciplines have, of course, changed over that period of time. And this has been a challenge for this work. We're not only working across disciplines, but also with colleagues who are kind of regularly changing in terms of the relationship to the work. I think one thing worth noting is that with so many diverse disciplines involved, it is very much less clear where the center is. So in some of the previous examples I gave, it was quite clear who were the kind of researchers at the core of the project. In this case, that is much less so the case. And so this project involves an ambition not only to develop new technologies or to conduct a kind of very specific program of research, but more so to develop a new paradigm for care. And this requires a very coherent and well-articulated vision, persistently expressed over time, I think. So I think there are different factors involved in making a project like this a success, some of which I will talk about in my final slides. But I think one point which is particularly worth noting in the context of this work is that our focus on severe mental illness, of course, brings with it quite heightened medical, ethical, and legal challenges, which we found tend to actually sharpen the boundaries between disciplines and highlight different ways of working. So those are the three case studies I thought would serve as a useful foundation for the conversation we might have. And I just wanted to end with a few slides where I kind of reflect in broader terms on, for example, what makes interdisciplinary work across these diverse projects. And so some of these reflections are not entirely novel, and where that's the case, I have cited relevant literature, which you might go about reading yourself if you have the interest. But the first point I think I personally found quite important in making interdisciplinary work relates to focusing on the problem and not necessarily the disciplines involved. So I think this is an error we can make in speaking so often of interdisciplinarity. We really need a shorter word, is that we can tend to prioritize the disciplines and our relationship to them rather than the problem we're trying to address. And this means, of course, that it's particularly important for us as individual researchers to be able to articulate and defend our own ways of working when working so closely with other colleagues. Another factor which Bronstein, for example, has highlighted as important, and I do believe relevant, is to prioritize relationships over hierarchies. I think this is important as a way of facilitating the kinds of conversations among peers that are necessary to making interdisciplinary research work. A related point is the need to develop a team dynamic, which Phillips describes as reflecting neither the extreme of perfect unison nor that of unbridled conflict. So we need to generate a context in which we're able to make productive use of the differences between ourselves as individual researchers working across disciplines. This requires, of course, the ability to respect others' expertise. I really like how Abdullah puts this, which is the ability to make mistakes gracefully. And I think this reflects well this need to have some humility when it comes to working with others. Finally, I think one aspect of interdisciplinary work that is ripe for further study is the nature of leadership required in this space. So what is it that makes possible collective ownership of goals across a diverse team? And how might the leaders in those teams reflect on their own leadership and develop towards those goals? Finally, some kind of more straightforward, perhaps, points, but which I think are really important, is simply to bring an enthusiasm to this kind of research, an enthusiasm which is likely to generate reciprocity among colleagues, and also the importance of simply doing work together. So, for example, something I found important in my current job is simply spend time at the different departments in which I'm involved, to have conversations with colleagues and to engage in tasks together. I think that's simply said, but a point on which many interdisciplinary projects can easily fall apart. Finally, close to finally, it is, of course, important as researchers working across fields that we're able to justify to ourselves and others our ways of working. And working and thinking about interdisciplinarity can be a challenge to this. Of course, when engaging this discussion, it's very easy to fall into debate around terms like ontology and epistemology. And so here today, I thought I would just outline kind of three perspectives which have been introduced in the literature, which I myself find quite meaningful in this regard. The first relates to human-computer interaction as a field in particular. So Alan Blackwell has argued that HCI is best thought of not necessarily as a discipline, but as an interdiscipline, in the context of which, as researchers and practitioners, we can actually think quite explicitly of our work as inspiring and motivating conversations among other disciplines, and perhaps being awkward in our approaches, and trying to make productive uses of those tensions. Another perhaps oppositional stance is taken by Eli Blevis and some of his colleagues, who talk about the value of a fourth wave of transdisciplinarity. So within the field of human-computer interaction, we sometimes talk about multiple waves as have arisen over time. And Eli and his colleagues talk about a potential fourth wave as in transdisciplinary terms, in terms of a focus on questions of ethics and values, and exploring kind of research agendas quite closely tied to important questions around sustainability and justice, for example, as overarching and cross-cutting themes. And so he positions transdisciplinarity not necessarily in contrast with other terms like interdisciplinarity, but as a useful perspective to bring to the kinds of work we do. The final approach and possible path forward here I thought I would briefly introduce is Wright and colleagues' view about the need for a radical form of interdisciplinarity, which they describe as a liberal arts perspective. And so this approach arises from a focus on the very much, as Wright and colleagues would put it, individual experience of technology, and as a resistance to the kind of development of any kind of a science of the particular. So the idea here is that we need an approach to research and design in particular, which prioritizes individual experience. I could speak more, but I will leave this for further reading if you're interested. My last slide, almost I think, is I wanted to make just a final note on the particular field and topic of health technology design. So in looking at the prior literature around interdisciplinarity, there has been very much that is written about interdisciplinarity across diverse fields, also within and across medical contexts. However, I think that the health technology case brings some kind of novel considerations in this respect, which we would do well to attend to further. And so I think one consideration worth flagging is the fact that the medical context raises challenges related to not just different ways of working and thinking about research, but also kind of ways of being, if you can understand what I mean, as researchers and designers. For example, many designers are focused on developing meaningful user experiences, embracing uncertainty as part of this process, whereas medical professionals, on the other hand, are often quite averse to uncertainty, and understandably so, and think in terms of risk management and medical safeguards. And so these can be quite difficult perspectives to align over the course of a collaboration. I think there exists a need to develop resources to support interdisciplinary ways of thinking. And that it's also worth, in the health technology context, recognizing that often when we speak about interdisciplinary, we're not only talking about research, but also about building systems. And so design and engineering activities in themselves lend new dimensions to this. One of the last points I'd like to make is that in all of this kind of complex language on interdisciplinarity, I think it's important also to kind of take joy from the kinds of work we do, and perhaps even employ joy as a meaningful guide in engaging in interdisciplinary research. These are often kind of long-term complex projects, and we need a way to sustain us. And I think that in itself can be a valid motivation for engaging in these interdisciplinary ways of working. Of course, a culture of collaboration does not just happen, but must be formed and fashioned by many hands. Of course, that is something that we are trying to do as part of the Open Digital Health Initiative. It is also a good segue to giving my thanks to many colleagues and collaborators over the years. And finally, to you as the audience for listening to me here today. So I hope this talk can serve as an introduction to an interesting conversation.
Great. Thank you very much, Kevin. That was super interesting. Now we will have a little bit of time left, 20 minutes to have a chat about this, and for people to share their own experiences, ask some questions if they have any. So yeah, feel free to post them in the chat or to raise your hand and unmute yourself, maybe even put your cameras on so that we can see you all. It's nice to see who's in the room. Yeah, so I see Anne has her hand up.
Yes, hi Kevin. Thanks for the talk, and I really liked your slides as well. I like the pictures that you put up. Very cool. I was just wondering, what do you think about, or how do you think about describing different roles in what detail and different expertise in? Because I mean, if you describe them too fixed, then that this may inhibit creativity. But then if you don't describe them at all, people may, impact on or try to impact on each other's work package. So do you have any opinions on that?
Yeah, I think it's a really good question, and something I was thinking about myself in putting together this talk. So you might have seen that in how I presented myself across the 3 case studies I gave, I also kind of gave some thought to how I did that and how that might have changed over time. And so I think this is quite a significant challenge and an important factor in how we engage in interdisciplinary research. So one thing I'm quite aware of is that we might ourselves have these kind of complex, abstract ideas about what we do as researchers or practitioners and what our precise role is. But of course, if we can't communicate that in a precise and clear way to our collaborators, then it can really be quite detrimental to the kind of collaborations we want to develop. And so there has been some work looking at different ways of presenting ourselves and defining disciplines in particular. So, for example, as human-computer interaction researchers, one description that is often used is to think about ourselves as T-shaped professionals, where, for example, you might have a kind of broad knowledge of different fields, but a deep expertise in one in particular. And so I think these kind of visual ways of thinking can be quite helpful, actually, and something we might make more use of in how we present our professional profiles to those we work with.
Thank you.
Is that something you have experienced in your own work or struggled with?
Yeah, a bit. Yeah, I've been part of multidisciplinary teams as well, and yeah, the sort of blending of expertise sometimes, yeah, can get a bit difficult. So so the project I worked on in the UK, for example, we had patient participation groups and practitioner participation groups. So those would basically just come together every month and then get sort of like a set agenda to add to the project. But then the project leader, which were health scientists mostly, they would make the decisions. So yeah, there was some input, but it was used as like advice and not necessarily expertise. So yeah, but yeah, I don't really know how you would do that better, or if that is the best way. But yeah, I've always found this quite challenging. Now.
Yeah, I totally can relate to that experience, and I think one interesting element of the literature in the interdisciplinary space is a focus on language and how certain kinds of language and ways of speaking and presenting ourselves can actually lead to different power dynamics. So something I've seen spoken of in literature and experienced myself at times, for example, is computer scientists' use of technical language as a way of taking ownership of a conversation, establishing a particular point of view of how things should be done. So,
yeah, yeah, that's actually a really good point. Like the way you, and I did really like your point about like acknowledging other people's expertise and your own expertise, and sort of like making clear like where is everybody's expertise, and really listening to also just lived experiences of patients. So yeah.
I remember when we had group psychology back in my undergraduate, I think there was some research presented where our professor was saying that it would be very helpful if during these interdisciplinary meetings, everybody would like have a little sign in front of them, not only with their name, but also kind of with their background. And, you know, as you start these kind of projects, to actually give a little insight into sort of, you know, what is your core sort of will be your contribution, what is your core knowledge, kind of expertise.
Yeah.
And yeah, I can totally relate to all of this as well. Working in implementation science, but that's kind of my T line. And then, you know, health psychology is where I identify myself mostly with. I would say, yeah, I've learned pretty early on that it's important to be able to really have, you know, your own discipline as the main focus, but being able to communicate that to others in a way that's actually understandable to people, like what you do, not in this like computer science language, but you know, when it comes to psychology, just really communicate it in very understandable terms, and also acknowledging that people do have also some understanding in what you're talking about, so make it relatable for people. So yeah, I can really relate to that. I see that Lenka has her hand up. Lenka, would you like to come in? We cannot hear you yet.
Let me see. Can you hear me now?
Yeah, now we can hear you.
I took the meeting outside, so that slight issues with technology. Great talk. Thanks a lot for also the discussion. I love the point about team dynamics, which I think relates to all of this. I have been in interdisciplinary research teams for quite some time, and starting as a very young researcher, so coming out of my master's, I did have expertise in what I was, you know, member of the team for, which was psychology, but it was extremely difficult for me to not be super afraid to speak out loud in front of, let's say, professors, you know, members of the team that were just higher up in the hierarchy. And I feel like I'm not usually the shyest person, so I feel like other people might have even more issues. So I would just like to stress this point about team dynamics and creating, and group psychology as well, as you mentioned, Seb, creating a space where people not only can express their opinions, but they kind of have to, you know, like you would deliberately give space to people to give input, to see if it resonates or it doesn't, if there are any thoughts, any you know, any maybe question marks or exclamation marks. So I think that's that was a super great point that I would stress.
I think there's a term called psychological safety. Some of the research that I'm involved in kind of operating theaters where, you know, there's been a lot of kind of patient safety issues because people didn't dare to speak up, and where procedures were then put in place in order to allow people to have a word. And yeah, I totally agree with that point.
Yeah.
And I always tell people in these kind of projects that if I don't understand something, that I will ask the stupid questions. And I think that's actually a really beautiful thing. If you don't understand other people's disciplines, and it's kind of this taken for granted, if somebody comes in from a different discipline and they dare to speak up and sort of admit that they're naive to this, it really sometimes uncovers a lot of important issues, I think.
But saying that you're going to ask stupid questions is easier when you are actually slightly higher up in the hierarchy, because
that's true. Yeah, when you're a PhD student, when I was a PhD student, I was just sitting there in the corner and just smiling.
I know Emily has a question, but I think that's a really important point. One of the things that's been on my mind in this regard is there's been a lot of work in recent years around defining and developing academic leadership, which includes things like creating spaces where people feel comfortable to express their views. And I wonder if there's more we might do in developing a view of interdisciplinary academic leadership and what that precisely entails.
Yeah.
Hi, Emily.
Hi, Emily.
Thanks. Hi, thanks very much. So just kind of following on from these points, really, it wasn't a separate question. Because I remember a time when I was making a booklet on breathing retraining, and we were working with respiratory physiotherapists, and they would use terms we didn't understand, and they expected things to be done in a different way from what we did. But I mean, I would have to just not worry about being stupid, because it was important to get the booklet written properly. So that was, yes, it can be difficult, but sometimes if you feel like you've got to get things done properly you've got to produce the end product, then you do have to speak up. And I mean, it helped that we had a really friendly team. I guess if there's someone who you didn't feel comfortable speaking to, it'd be much harder.
Yeah, and try to have the leadership, the non-hierarchy, like relationships over a hierarchy, I think was a very good point that you made as well, which yeah, makes for more psychological safety, I think. But I know it's
also the point that Kevin was making around being problem focused rather than discipline focused, right?
Yeah.
Like it sounds like what Emily is talking about is like you had like an end product in mind, and you sort of had to be pragmatic about how to get there, right? So it's like, yeah, if we talk about research philosophy, I think pragmatism is a key word to actually achieve what you've come to achieve, right?
And I feel that maybe in the applied research, especially when we work with either companies or medical facilities, it probably has to be us who's kind of keeping track of this and making sure that we create this environment. Because my experience is that companies work differently. The hierarchy is usually set. So I feel like it needs to be us researchers trying to create this space, which then helps the research itself.
Yeah, it's really tricky though, right? Because you have to make yourself extremely like vulnerable in those situations sometimes, I think. And yeah, it's almost like sometimes you just have to have like a general conversation to open yourself up and allow those kind of talks to happen, right? Whereas like oftentimes if it's a research project, their work package updates and everybody sort of like gets on with what they've been tasked to do. And then there's no time for just, more naturally arising conversations. I don't know if Kevin has any sort of words of advice from those different projects, any sort of tips on how to create some sort of like more dynamic interactions.
Yeah, I think on that point, and also touching on something that Lenka said, is about just the importance of making people feel involved. And I think also by perhaps allocating tasks and activities for multiple people to engage in, I think that by working together, we kind of work through some of those sometimes abstract differences in terms of, let's say, epistemology or just ways of thinking about research. Sometimes it's easier to actually work with someone on a pragmatic task through those challenges rather than having a kind of abstract conversation about perspectives on research. There has been some prior qualitative research actually asking researchers their perspectives on involvement in interdisciplinary research. And one of the outcomes from that has been the fact that although the literature talks, for example, about the importance of knowing your own epistemology and being able to communicate that and having a grasp on a set of research methods, in reality, researchers working this space tend to say that actually they don't talk very much about epistemology with their collaborators, and it comes down to more interpersonal characteristics and just a willingness and ability to work together. So I think focusing on that aspect of how we might develop, for example, tools, whether methodological or practical tools for helping people do interdisciplinary research and working together as teams is one way forward.
This is why I always just work together with people that I get on with.
Yeah.
If I can help it at all, if there's a choice. And sometimes you find out only later that you cannot get along with somebody, which then you just got to get on with it. Huh? Is anybody else who hasn't shared their thoughts yet? Anything that they would like to say? Any examples they would like to share? Any sort of experiences that they've made with working interdisciplinary?
Perhaps I could ask for those present, to what extent you think of yourselves as interdisciplinary researchers. Is that a term you would apply to yourselves, or how do you relate to that concept?
So I work in an interdisciplinary team. Like, I wouldn't say I'd say my own research covers several disciplines, but I'd say, rather than being an interdisciplinary researcher, I work in an interdisciplinary team.
So what is your background, Emily?
Oh, health psychology.
Okay, yeah.
But yeah, I've worked with so healthcare professionals and computer scientists. And I'd say in some ways, computer scientists, it's quite challenging, and it's important to kind of divide out the project in line with what Kevin said, to divide out the project in line with different people's expertise, because maybe this is just my university. I've found that psychologists tend to have a better training in ethics, for example, so compared to computer scientists. So whereas they're more expert in how would a system work, and they'd know the limits of a system. So yeah, about respecting everyone's expertise, really.
Mm-hmm. Well, one thing I've been struck by at times working in the health technology space is that some computer scientists and medical professionals actually have more in common than they might think in terms of their worldviews, which often imply a kind of evidence-based, kind of rational view of reality, which I find actually conflicts more often with kind of social scientists or qualitative researchers in that respect. Is that been your experience, Anna?
Yeah. I was just thinking that we sort of, I think all of us generally think about, like, you put something in, either the brain or the computer, and then something happens, and then something comes out, like behavior. So very, very generally, yeah, I think so, yeah. Yeah, I think coming back to your earlier question, I do see myself as an interdisciplinary researcher, but not very, as in I've worked like health psychology, health sciences, but I don't know nearly enough about computer sciences to actually call myself that. So I think like interdisciplinary, as in I can do health sciences and I can do health psychology and a bit of anthropology maybe, but that's all very much in the same corner, I think. Yeah.
Mm-hmm.
Anyone else?
Are you in the agreement with Anna? You present yourself in the same way?
Sorry, did you ask me?
Yeah, sorry, Sebastian.
No, I mean, I'm definitely in agreement. Something that I find more and more these days is, I'm kind of working in implementation science, but with a health psychology background, but so always working with healthcare practitioners, and more recently kind of doing a lot of sort of co-design work. And something that I've noticed is that a skill set that I'm completely missing in co-design is like just bringing people's ideas out in a non-health psychology way. So I'm now actually really looking to sort of work more closely with people with a design background, people with an arts background, that can actually during those workshops, tease out some of those ideas for me, or that I can learn how to do it in a way. So at the moment, my interdisciplinary working is very much driven by me lacking certain skills that that would really help me accomplish my tasks. So yeah, it's an interesting one.
I actually
I think
oh, sorry.
No, go on.
No, I think interdisciplinary teams are great, actually, because it sort of also acknowledges that we don't know everything, and we need other people's expertise to make something good and something sustainable and something that people keep on using. So I'm all for adding more people to the team, and also in that way, maybe we should think about having more authors on papers, because usually it's only like 4 or 5. And I
That's
actually
of course
think
a tricky bit. Yeah,
it is, yeah. But often there's so many people who contribute to the success of a study or a project. Then I think we should allow that a bit more often. Yeah.
I think that's a very good finishing comment, Anna. Very nice. As Kevin wanted to have a final word as well. We're coming up to the hour now, so it's been a really nice conversation so far.
I think Anna put it perfectly.
Perfect. Okay. Then I will finish off today's discussion. Thank you again, Kevin, for giving this really beautiful overview, sharing your experiences. And if you have any sort of like references that you would like to share, you can send it to me afterwards. I'll put it up with a recording of today's session. So again, thank you everybody for coming on this hot day, and enjoy the rest of your week, and hopefully see you for the next Open Digital Health event.
Thank you for organizing, and thank you for presenting.
Yeah, thank you, Sebastian and Kevin. It's been really interesting.
Great. Thank you, Emily, for coming.
Bye-bye.
Bye-bye.
Thanks, everyone.
Bye, Kevin. Good to meet you.